Hello, lovelies. Good afternoon, good morning, good night, good evening, depending on your location, where you are joining us from. Welcome. Let's join in, lovelies. Who is Testimony Adeleye is number one. Testimony the champion. Welcome, my lady. Join in, lovelies, beautiful ones. Alice James is here. Thank you for being here, my lady. Elizabeth Chidima is watching. Chinaka Lawrence is here. Vicky Bimbo is here. Chineke Rosemary is here. Come on in, lovelies. Omo Wonola is here. Ambe is here. Oyebisi is here. How are you all doing? I'm doing all right. Sandra Waneri Lawrence is here. Thank you, Elizabeth, for that compliment. I appreciate you. Vivian Wenzi is here. Lovelies, let's join in. Thank you all so much. Chiwe Ekenola is here. Come on in, lovelies, beautiful ones. Beauty Queen is here. Nice to have you. We have 19 viewers. So let's keep commenting. Let's distribute, lovelies. Tell others we are about to start our lecture on hepatitis C and your liver. So come on in, lovelies. Let's do this. I see 18 viewers. Bringing others. Come on in, lovelies. Lawrence Ugochukwu is here. Scholastica is here. Thank you for being here. Guys, let's join in. 26 viewers. That's good. Come on in. Let me give you guys 5 more minutes. Come in so that we breeze in. It's not going to be a long lecture. I'm not going to preach today like some people tell me that I preach like I'm in the church. So come on in, lovelies. Let's do this. David Jennifer. Stella Dapper is here. Anastasia Amakaoji is here. Come on in. Chinwe Kenola, thank you for being here, lovelies. Come in. Let's start this. Join, lovelies. Join. Beauty Queen, thank you for being here, my lady. Thank you, Stella Dapper, for that compliment. Thank you so much. Olabisi is Obieshi is here. Thank you, David Jennifer. Thank you. My family is doing all right. They are yet to come back. Everybody is out. I'm here with Daisy. Thank you guys for being here. So join in, beautiful ones. Laugh more. Nice to have you. Jalika, nice to have you. Yola Florence, good evening. I see some new people here. Okay, Kechoma is in the house. Divine Ibawuchi, thank you for being here. Okay, come on in. Chimalume is here. My own Queen Paula. Queen Paula is in the house. Come on in, my queen. Nice to have you. Elizabeth Chidema is here. Thank you for being here. So we are 32. That's good to go. Let's go. So let me put on my glasses so I can rest my phone and see everyone's comments. So let's, start. Guys, look at what Daisy did to my glasses. She ate it up. This puppy is a bad one. She ate my glasses and the thing is hooking to my hair. Okay, I can see very well. Okay, Kechoma, nice to have you. Thank you for being here. Oluchi Fomado, it's a pleasure having you. Macy Adeze, nice to have you. Come on in. Alade Olu Akemi is here. Thank you, my people. Jasmine is here. You all are welcome. Thank you. We thank God for this day. So, our topic today, who can remind me our topic? Can somebody tell me our topic? If I don't mention your name, you are highly welcome. Everybody is welcome. Franciscan, Ukeja, you are welcome. Lily Sandra, everybody is in today. Choice Ben, thank you for being here. Eniola is here. Thank you guys for being here. So thank you for those that participated in sharing our words to the street. While we are remembering those, online, we remember those offline. So you show kindness to whoever you meet is very, very necessary, because you don't know when you can, when you will entertain an angel. So continue to spread love. Is a way of, sharing with us, how we can give. It doesn't matter how small, it doesn't matter how big, but it's the heart that gives. Maurice Chibunde is here. Thank you for being here. Whenever I see you, I brighten up because I know something good is coming. Don't fold my hands. So thank you guys so much for your love. Thank you guys for everything. Anastasia, you are absolutely correct. Scholastic hepatitis C virus. Chimalume, thank you. Macy Ades, we are talking about hepatitis C today, not the B type, but the C type. But all of them are all viral. But today we are focusing on hepatitis C and the liver. Vivian Wenzi, exactly the way I put it. Hepatitis C and the liver. This is our topic for today, because when we are looking at hepatitis C, anything hepatitis is the liver that is mostly affected. Although, the liver controls a lot of functions in our body, but when hepatitis C virus sets in, and if not well treated, or if poorly treated, like I said, or if not treated or left untreated, it causes a lot of damage to the liver. So this is why we are talking about this. It's not that all issues that come with the liver is as a result of hepatitis C, but hepatitis C is one of the infections that attacks the liver that when we leave it untreated, has a lot of damage that it does to the liver. So, because some people, when they present in the hospital, they try to do some, liver function tests. They try to do a lot of, tests to see what caused this. Most times, some people may test positive to hepatitis C, which is a blood-borne, type of infection. So, depending on whatever that led to the liver damage or liver failure or liver disease. So, but it's not all liver issues that is as a result of hepatitis C, but hepatitis C is one of the predisposing factor. So, hepatitis C. With this little introduction, can somebody tell us what is hepatitis C? I already mentioned it, but I want somebody that that was listening to tell me what hepatitis C is. Tope, nice to have you. Apan, it's nice to have you. Can somebody tell me what hepatitis C is? I already said it, but I want to know who is listening. Hepatitis C, what is it all about? Hey, my Paula is here. Yes, your health is your money. Actually, ignorance, yes, is not good. So, come on in, people. Hepatitis C. What is hepatitis C? Can somebody define what hepatitis C is? Gabriel, nice to have you. Tope, nice to have you. Chiwe Kenolo, you are welcome. So, hey, my sister is in the house today, in the house today, in the house today. We are full today. Thank you, my sister, for being here. I love you all. Thank you, everyone. Greetings, my beautiful sister. Nice to have you. Thank you so much for gracing us, with your presence today. So who can define what hepatitis C is all about? I just mentioned it. Give me a brief description of what hepatitis C is. What is hepatitis C? What is hepatitis C? Let's go, let's go. Maybe this one will come with something. So who can tell me? Hey, Miss Beatrice, my family is doing all right. Thank you for being here, my lady. Who can tell me what hepatitis C is? Okay, Tope said it's an infection that is caused by a virus affecting our liver. That's good. Nelly said it's a liver infection caused by hepatitis C virus. That's good. Thank you. Adaeze said infection that affects the liver. Okay, that's good. It's a blood-borne kind of infection to the virus. Testimony, you twisted it around. I need another person. Can somebody give me what Scholastica said infection or disease that affects the liver if not well taken care of? Okay, so thank you, my sister, for that remind. So, my people, who can tell me what hepatitis C is? Kind of infection. Is a blood-borne kind of infection. Okay, that's good. Another person, give it a try. I want somebody to make that definition. Give me that definition. Bring what everybody said and put it together. It can range from mild, acute to serious chronic condition that can damage the liver, liver failure, and even liver cancer. Okay, but who can give me the description by bringing what everybody said? Who can give me that one particular definition by bringing what I read out everybody said? Just put it in one word. Can somebody tell me what hepatitis C is? Give it a try. Maybe you're gonna go on lunch with me today. Give it a try. Let me see. I'm waiting. I said today I'm not preaching. We're gonna talk. We need to discuss this together. Thank you, my mom. Thank you so much for the start. Can somebody give me the full definition of this hepatitis C? I need the whole word I listed out. Oyebisi said infection caused by a virus that attacks the liver and leads to inflammation. Okay. Testimony, infection caused by virus that attacks the liver and leads to inflammation. Okay. Divine said is a virus that affects the liver detected through the blood. Okay. I am still looking for that particular thing. That is one thing I'm looking for. Everybody is correct. For real, everybody is actually correct. But I am looking for one word. Anesthesia said infection that affects the liver. It is a blood-borne virus. Okay, that's okay. I am looking for one particular thing. Yes, 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 yes. Actually, Okay. Okay. I'm reading. Testimony said blood kind of infection that affects the liver and leads to inflammation. Anesthesia came with that word first. Let's go. Anyways, everybody is correct. And all of you that I mentioned, you all are correct. So I'm going to look into that. So what is this, hepatitis C? From my own word, is a viral infection. Is a viral infection. Just like we said, it is an infection caused by virus. It is a viral infection that affects the liver, causing the liver to be inflamed. And this is a blood-borne type of viral infection that affects the liver, causing it to have inflammation. We all are correct. I was just pulling all you guys' legs, and all of you are correct. So I'm gonna look into that. So this hepatitis C, let me say in the year 1992, it was more rampant because of most of the on-screen blood. Some things we may talk here may be a little sensitive according to Facebook community guidelines, that I may twist my my tongue in mentioning some of them. So but we are all driving into the same direction. So this hepatitis C, 1992, before, 1992, it has been rampant that, a lot of blood are being unscreened and people are being transfused and they end up contacting this virus. So this virus is a blood-borne type of, infection. Yes, it may be contacted through sexual too, but most times is when it is blood connected. That's why it is very, very important, And one thing with this hepatitis, whenever hepatitis is being mentioned, we are looking towards anything that has to go into damage to the liver, knowing how important this liver is in our body. So when this hepatitis C gets into the body through its port of entry, which is blood to blood, contact, it can be through sharing needles. It can be through contaminated blood. It can be through sexual. It can be through even tattoos. It can be through piercing. It can be through anything that has to do with blood-to-blood contact. It is not really like genital, fluids, but unless if there is blood contact in that fluid, that's how the person can easily get this kind of a viral infection called hepatitis C. And this hepatitis C is a treatable type of infection. You can treat it. Yes, it can be treated about 95% when being treated appropriately with the right antiviral medication. They get well from this, hepatitis C, that it will slow the progression to liver damages or infection. So that's why we are trying to enlighten everybody about this, issue, because I have noticed piercing, body piercing, tattoos, they are coming back into vogue. Now is very, very rampant that a lot of people going into the, places, they open stores, you don't know how the equipments are being treated, whether they are being sterilized, and people are going in for tattoos they draw to their skin. How sure are you that the equipment or the instruments they use are well sterilized? And this is why we are bringing this to your notice, just to enlighten you. We might have known about this disease condition called hepatitis C, but we want to reinforce what we have known about this illness. It is coming back. A lot of people are testing positive to it. There was a time it was, in slow progression that people were not, testing to it, but now it is coming up. Hepatitis C is now getting rampant, that the cases we have are getting, in increase because of what a lot of, activities going on, which we will get to the prevention. So let me look at my book so that I will not lose focus, because if I keep going, I may not bring it to, in order. So what does this hepatitis do when it gets into our bloodstream? One, it causes what we call the liver cirrhosis. There is something we call the liver cirrhosis. The liver being on the upper, part of your body, I think is on the right side. The liver is being situated there, that when this hepatitis gets into your bloodstream and you don't know about it because it doesn't show on the face until you are being tested, or your partner or anybody around you being tested, you will be like, okay, I might have been sharing something with this person, let me go and test myself. That's how the thing, it may have been there, you may not even know until you go to that, test. So when it gets into your body and it's been there untreated or poorly treated, it causes what we call liver cirrhosis. The liver cirrhosis is just scarring, like having scar tissue formation in our liver, because this infection has been there. left untreated, it has been affecting the liver, causing scars on your liver, and you did not know. And when it keep being there causing those scars, you see the liver, due to that inflammation. When you hear inflammation, what we medically mean is infection. When this infection is going on, the liver is fighting this, virus that gets into the liver. So it's fighting it. When it is fighting it, it is causing all this scar tissue, deposits on it. And when it continues like that, the liver becomes weak and hard because it cannot fight off the infection until it gets the antiviral medication. So if that medication is not being given to kill this virus that is attacking your liver, the liver becomes hard. And when the liver becomes hard, that's what we call the liver cirrhosis. It is one of the things that affects the liver. It's one of the disease condition of the liver. Chineke Rosemary, thank you so much for the star. So what is this liver cirrhosis? What are the signs? You will see the person, you're looking at the person is, the skin is turning yellow, the eyes are yellow. That's how you know somebody that has this liver cirrhosis. You see their abdomen have what we call ascites, like fluid, they fill up the stomach. And they are very, very hard. You see those veins are very conspicuous. These are some of the signs of somebody that has this liver cirrhosis. There is something else we call the pruritus, which is rashes. You see the body, you will see the person's body itching without any visible rash. The person keep itching the skin because of this, things getting into the interstitial cells. Then there is something else the person presents, what we call the dark colored pee. Yes, that's why whenever I tell people, when you pee, you look at your pee. Your pee can tell you a lot about your health. Yes, when somebody has issue with the liver, the color of the urine talks to dark color. Then the poop is like pale in color, which is like fat, That's how oh my God, Maurice, thank you so much for the stars. That's how the poop looks like, pale colored, like a clay. That's how the poop looks like for that person with liver cirrhosis or liver issue as a result of untreated hepatitis C. Then there are also small yellow bumps or fat deposits on the person's skin and eyelids. If you look at the person, you will see like, yellow bumps around the person's, eyelid scattered all over. Is some of the presentation because of the jaundice and yellowiness of the skin. There is also unexplained weight loss and fat loss. You see the person losing weight. The only thing that is getting big in that person is the stomach. That's the presentation of the person with liver cirrhosis. There is also what we call hepatic encephalopathy. This is just mainly disruption in the brain. You see that person getting confused, disoriented, they are having deliriums, they are, talking things that makes no sense. These are some of the things. This hepatitis, when you leave it untreated, go into the liver, damaging the liver, causing that person to have what we call liver cirrhosis. Then there is something else we call disruption in menstrual cycle. Thank you, Beth Prime, for the star. Thank you so much. Disruption in menstrual cycle is not all the disruption in menstrual cycle is as a result of liver cirrhosis, but it's one of the symptoms somebody with liver cirrhosis presents. Then there is another thing we call enlarged male breast tissue. You will see the person, the breast tissue gets enlarged, the stomach is enlarged, you see the testes is shrinking, and all those stuff. Those are the presentation the person presents when they have what we call liver cirrhosis. And this is as a result of untreated hepatitis C. So that is why it is very, very important. When you have this, you notice you are sharing needles, you are sharing razors, you are sharing shaving stick, You are a tattoo person. You are piercing everywhere in your skin. You are indulging in one thing or the other, illicit drugs, that you are sharing needles and all those stuff. You are a healthcare provider, that you expose yourself to body fluids. These are the things, the risky things that you have to check about yourself to know whether you have contacted this disease. If not, you make sure you care for yourself and be precautious. So this is what this hepatitis, what it does to the liver, causing what we call liver cirrhosis. Then another thing untreated hepatitis C can cause is what we call liver failure. You know that liver failure, I know we spoke about liver cirrhosis because liver cirrhosis is leading to end stage of this liver failure. So liver failure is one of the complications that come with this untreated hepatitis C. When it damages the liver fails. The liver has a lot of functions, that it maintains in our body. It's important as your kidney, is important as your heart, is important as your brain. That's how important the liver is, that we need to guide it very, very jealously. So when the hepatitis is untreated, so if you are one of those people that have been exposed, it is best for you to get to your doctor. Tell the doctor, please screen me and let me make sure I am okay. If those things, oh my God, doctor is in the house. Oh my God, Dr. Chiamaka is here. Thank you so much for being here. Thank you for the stars. So if you are predisposed to any of these issues we spoke about, that you are suspecting yourself, am I, exposed to this Hep C? So it is better for you to get to the doctor, get yourself screened, because the liver is very, very important. The liver helps in our metabolism. It converts whatever we ate to glucose, energy, or anything you want to call it. The liver stores and releases this glucose for our body to maintain our normal sugar level. The liver, what it does is also detoxifies. It detoxifies harmful substances. We excrete them. Either we excrete them through the poop, we excrete them through the urine, or it being, removed from our body. It also converts alcohol into harmless, substance, because that's why you don't consume too much to weaken it, because your liver is very, very fragile. Even the little you take goes into your liver. The medication you take, they all get into your liver. So you don't want to over-labor this liver. Thank you so much, Dr. Chiamaka. You are highly welcome. So this liver is very important, that anything that weakens it makes it dysfunctional. So it is important we know this, liver functions, so that we can be able to take care of it. The liver also has hormones that regulate our growth, that regulates our sugar metabolism, that also regulates, our body metabolism too. Everything, the functions that go in with the food and energy, and breaking those energies, and breaking those fats and all those stuff, all are centered in the liver. Then untreated hepatitis C also can increase your risk of liver cancer. All these things is all about liver. This is why we are talking about this hepatitis C and how it affects our liver. When you leave it untreated, it has a lot of damage to the function, to its metabolism. Even if you have any issue going on with your liver, it makes it worse. So that's why we have to make sure we are free from this virus. As we can do anything we can to make sure that this virus does not get to us. And if you notice that you have been exposed to it, please get screened and get well treated. You stand the chance. You stand the chance of getting, well from it. 95%, you can be cured from it. So another thing this untreated Hep C can cause is it messes up the liver, that plays important role in formation of the platelets. When it comes to blood clotting, everything comes from the liver. So that's why when this liver is being affected, the person can easily bruise or easily bleed. So all these things are centered in the function of the liver. Then another thing, like we mentioned before, is what we call ascites. This ascites is just swelling of the stomach. They come as a result of liver cirrhosis, liver damage, all those things. They are presentations of somebody that has liver issues. So that's what this hepatitis virus, does to our liver. Another thing is excessive tiredness. You see the person always tired, fatigued. Anything you do, you are always tired. Check your liver and make sure your liver is functioning well. So how do we contact this virus? With all these things I have said, can somebody tell me how we can contact this virus? How can we contact this virus? How can we contact this virus? How can we contact hepatitis C? Can first person tell me how we can contact this virus? How can we contact this virus? How is hepatitis C being spread? Yes, it is through blood. It is a blood-borne disease, but how can we contact it? What are the ports of entry? Testimony says sharing needles. Absolutely. Yes, sharing needles, piercing. These are ports of entries. When somebody has that disease and you share needle or you share the same equipment with the person, that person can, you can get infected through sexual intercourse. Absolutely. Especially when you are the type that can have your intercourse during your menstrual cycle. There is possibility of getting that, hepatitis C. Or if you have what we call sores, genital sores, there is possibility of infecting. It does not go through your vaginal fluids, but it's when blood is involved. Absolutely. On-screen blood transfusion. Thank you, Paula, for your stars. I appreciate you. On-screen blood transfusion. Like I said, since 1992, then words. That time they don't screen the blood. If anything happens, there is anemia, there is need for blood, they, get your match and give it to you without screening for those, hepatitis and all those stuff. There is possibility of the person getting it. Razor blades, sharing personal items like razor blade. Yes, we love our husband. We love your husband. You don't know what your husband does. You don't know what your wife does. Yes, we sleep together. But sharing personal items, you are sharing personal items with your kids. You are sharing personal items with your brother. You are sharing personal items with your sister. You notice that you have some hairs on your skin, on your chin. You are like, okay, brother, can you give me your razor? Let me shave off the little hair I see. There is possibility. If that person unfortunately has hepatitis C, there is possibility of infecting you with that, hepatitis. Yes, absolutely, we are all right. How do we contact this viral infection? It can be through is blood to blood. It can be through on-screen blood transfusion, like we said. Absolutely. Sharing needles or other drug-related equipment. Like people that work in tattoo places, piercing, those things are not being sterilized. They use it on you. It becomes a problem. Sharing healthcare exposures like nurses, doctors, you are doing surgery, you are doing invasive procedures, you are giving somebody medication through intramuscular or IV or anything, or even whatever procedure you are doing and there is blood to blood contact, there is possibility. If that person is positive to Hep C, there is possibility of infecting you. That's why as a healthcare, personnel, you always wash your hands. You always wear your PPEs, your protective equipment. You always make sure you wear your protective goggles. Wear your gloves. Be careful with needle strikes. These days I don't know how it works in Nigeria or where we are logging in from, other countries, but I know in US here, most of the needles we use, we don't cock the cap. Is the retractable needles that when you give the injection, the needle retracts. We don't normally use this the one you have to place the cap back on it, because there is possibility of getting needle stick. So as a healthcare personnel, be very, very careful, when you are handling needles. Some people, we don't used to do, those days, reusing needles. Those ways are ways one, thank you, Rosemary, for the stars. Those ways are ways one can infect others if there is somebody with this Hep C. Another one is sexual contact, like we said. Yes, it can go through sexual. There is possibility of, if your partner is Hep C positive, to infect you through being together and having intercourse. Then another one is from infected mother to baby during pregnancy or childbirth. Yes, there is possibility, although the chances are very slim, but still the baby, through the placental barrier, this hepatitis can get in because there is blood-to-blood contact. But when a woman is pregnant, it is not encouraged for that person, to get these antiviral, medications, because of possibility of causing damage to the baby. What they do is the woman, they have to monitor the person until the person gives birth. And once the person gives birth, the first 3 months, they don't test the baby, but after 3 months, they can test the baby till 18 months. But 3 years, once the baby is being tested and the baby is still positive, because God is so wonderful that some babies, when, they are being born, God, changes everything in that baby's, system. But if that baby at age 3 is being tested positive, that's when they can start this baby on antiviral medication to make sure that, is being cleared from the system. Adabeye, thank you so much for the 100 stars. I appreciate you. Then another one is tattoos or piercing with non-sterile items and equipment. Yes, these are mediums. One can contact this hepatitis C. That's what is rampant these days, because every girl child, every male child, everybody wants piercing, everybody wants tattoos. Some people tattoo everywhere. How sterile are the equipments they are using? This is what we are talking about. If it's not your own personal thing that you use to make those piercing, just be very, very mindful what they are using. Make sure it's something coming straight from the pack, is a new product they are using for that piercing, so that you don't get yourself infected, because a lot of people have this. Not only hepatitis C, other things that can go through the blood like HIV, even hepatitis B. So a lot of people have this, that they can easily infect you through this piercing and through these tattoos. So be very, very mindful. I know they are beautiful. Yes, you want to, oh, fortunate child, she pierced her nose, I want to pierce my nose. Boom, you go to piercing parlor and they use whatever they have there and pierce you. And lo and behold, it wasn't sterilized. There is possibility of getting you infected. Then another way of getting, this is through organ transplants. These are like before, just like blood transfusion, before they started making sure they screen for all this hepatitis C, B, and all those stuff, before, that's where people can get these diseases. Then another one is sharing personal items, just like we said. Definitely sharing personal items. That's like, oh, it's my brother, I trust him. Don't trust nobody. Don't share their toothbrush. Oh, my boyfriend is your new boyfriend. You want to show him you love him. You take his toothbrush because you didn't have yours and you brush your teeth. There is possibility of getting infected through that, because there is blood, contact. Because some people, when you brush your teeth, believe me, there are some blood, particles that come out from there that you may not know. Some people, their own is obvious, especially people with blood clotting issues. There is possibility of getting infected. Don't show him that you love him. He will chew his thing and put it in your mouth. What is he chewing and giving you? Is there any blood contact with that thing he is giving you? That's not love. That's, ignorance. So those things are the things we have to be very, very careful. Nail clippers. Yes, we go to do our nails. We go to do our, fingernails and our toenails. The things they are using, are they new? Are they sterilized? That's one thing we have to ask ourselves. You don't want them to give you a cut from what another person used, and unfortunately that person may be positive. Welcome back, babe. Yeah, so that person may be infected, and unfortunately you end up getting it. So those clippers, you have to be very careful. If you have a wound in your hand, don't go there. I will tell you, don't go there until your wound heals. But if you don't have a wound, be very, very careful. If you are doing your nails and they hurt you with any of those blades, the clippers, or whatever they use, the files, please go and get yourself tested if there is any cut or any wound that comes as a result that you went to do your nails. Those things are the things you have to be very, very mindful about. So all these personal items, the clippers, those little hairs, give me your tweezer, boom, you tweeze, do your thing. You want to remove the little hair you found on because you don't want to buy razor, you don't need it. Are you sure that person is free? This is what you have to ask yourself. So these are the ways we can contact them, and these are the preventive ways, for this disease condition. This virus is very, 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 very serious. It's not a joke. Just like HIV does not show on the face, the same way hepatitis C does not show on the face. So there is possibility. It is very rampant these days. A lot of people are getting it, and a lot of people are testing positive, that we have to be very, very careful. Apart from the signs we mentioned with whoever that has failing liver, or their liver is damaging, going through the disease process of failures, what are the early signs you can notice if you are infected with this hepatitis C? Although at the early stage it may not be showing, but later you may be noticing the person having pain in the right upper part of the abdomen. That's where your liver is being located, because the liver is going through inflammation process. It's going through infection process. You will see your right part, the upper part of your abdomen, will be hurting you so much. When you notice that, it is not something will be like, oh, I may be having gas pain. I may be, if it's constant and you've taken your gas S to release the gas, and you think it's not going away, please go and see your doctor. Let the doctor rule out any issue with the liver. So please, it is very, very important we pay good attention to our body, because a lot of things, as the age is progressing, a lot of changes mimicking each other with the symptoms, that we get misled. And you don't want to be like, okay, let me drink antacid, the gas will stop. Let me eat Gelocil, the gas will stop, and you are constantly getting sick. Please go and see the doctor if you are feeling that pain on the upper part of your abdomen. Then another thing is abdominal swelling. Most times it's always end stage of this liver cirrhosis, but most times it begins early. That's when the liver has already been inflamed, been attacked. You see your abdomen getting big. It's not that you are adding weight. You are losing weight, but your stomach is growing bigger than your body. And you notice your stomach is like, it is full with fluid, very painful, and when you touch it, you see it's shiny. The veins are all conspicuous. please go and see the doctor. By then, you are supposed to have seen the doctor, because it is very, very important, and it may be as a result of, your liver is getting damaged. So when you notice those signs, it's not that you are adding weight, you are eating good or whatever. Go and check out your liver and see if anything is going on with your liver. Then another thing is clear colored or pale stool, like we said. You see your stool, you poop. I know some people don't want to look at it, but there are certain ways your body will be feeling that it's not everything you make quick to flush. Yes, you don't want people to get the smell that you flush it the first time, but before you flush it, did you look at it to see what you gave out from your body? How does it look? Is it dark, showing that you are bleeding inside? Is it clear colored, showing that your liver is being compromised? So look at your poop and see if it is pale. If it is clear colored, please go and see your doctor to rule out any liver issue or even anything going on. Your pee is dark colored. It is not supposed to be like that. Your pee is supposed to be amber in color, light yellowish. Sometimes when you are overhydrated, it may be white. You are underhydrated, it may be deep, amber. So, but your pee is supposed to be normal color. But when it is dark colored, look at it. It will be showing that color. It means your liver has something going on with it. Go and see the doctor. These are things, it's not to put fear, but it's to get yourself treated on time. Early detection helps with the treatment, because when it goes wayward, that it lingers and is being untreated, a lot of damages. Believe me, when the liver stops functioning is a problem. The same way as your kidney, the same way as your brain, the same way as your heart. They are all very important organs that play important role in a lot of things concerning your body and the functions. So please go and see the doctor. You notice extreme tiredness, fatigue. You are always tired, no matter how rested you are. Go and check and make sure it's not related to the liver. Although there are other conditions, like I said, anemia can cause you to have tiredness. Hypothyroidism can cause you to have tiredness. A lot of things can cause you to have tiredness. Just rule out those things and get yourself tested. And you are having fever. When there is infection in the body, it's always present with fever because of the antigen antibody, movement going on in your body, the body fighting that infection. So the inflammation brings up the fever. When you are noticing your temperature is high, above 100, getting to 103, go and rule out what is going on with your body. You notice itching. You are sitting, there is no hives, there is no poison ivy, and you think somebody poisoned you. You keep itching your skin, keep itching your body. There is no rash. You are looking at your skin, there is no rash, but you are always having these pruritus. It's things going on with your liver. Go and see the doctor. Another thing is jaundice, yellowness on your eyes, your sclera, yellowness of the skin. These are signs of jaundice. Please go and see the doctor to rule out, liver issue. So these are the things when the hepatitis C is being left there to keep fighting the liver. These are the presentations that, comes up. Then what are the important considerations when it comes to this Hep C virus? It is not considered as STD. Yes. Hep C is not considered as STD because its primary spread is through blood. Sorry, I gotta dry my mouth. So its primary spread is through blood, it's not genital fluid. So that's why it is not being considered as STD. But you can also, contact it through sexual. So that's why it is very, very important that we know our body. Maintain one partner. It is very, very important. When you have multiple partners, you are predisposing yourself to getting this Hep C, because are you using protection? How protective are you with whatever you are using? You may think the condom is 100%. It is not. Even when they tell you it's 99%, that 1% is very, very important that you have to listen and be very, very careful. Maintain one partner. That will be helpful, because those multiple partners you have, what do they do at your back? They may be in front of you preaching, I love you, baby. It's only you, without this, without. It's all lies. Immediately you step out, they step out. Because you have multiple, they will be like, okay, I can have multiple too. So all those things, please, it is better that we stick to one particular person so that we don't expose ourselves to this Hep C. Why sexual transmission is at high risk, but when you have multiple sex partners, having partners that have HIV can predispose you to all these infections. When blood is present through sexual intercourse, that can make you at high risk for this. What are the treatments? We use antiviral medication for this. Yes, it's antiviral. It doesn't mean that you have HIV, but it's what they use, because since it's a virus, it means they need antiviral medication for it. Get yourself treated. Go through the course of the treatment. Get yourself well treated. If you have a partner, it is important you tell your partner, I tested positive to Hep C. Go and get yourself screened. It's better both of you test each other, test yourselves and get yourself treated. Because if you treat yourself and you are not well treated, and your partner is not even treated, and she's not even sure of her status, then it means there is possibility of reinfecting yourself. So it is better, as you are treating yourself, your partner get treated. Or when you go for test and you tested positive, tell your partner, please go and get yourself tested. I tested positive. There is no harm in that. It is curable. This is not HIV that you can, that is not curable. But this one is curable, so that everybody can get cure from it. And when you are under the treatment, if in case you tested positive, your partner is negative, before you meet your partner, please use protection and protect her. If you cannot abstain through the treatment, when you are being treated for this, even when you stop, the treatment, everything is being treated, you finish your course of treatment, go back to the doctor to make sure it is being cleared from your blood before you continue, with your partner or whatever, because you have to save yourself. You don't want to damage your liver. You don't want your partner's liver to damage. You don't want to get yourself reinfected, because there is possibility of reinfecting yourself. So please, if you are being treated, make sure your partner get tested and being treated if she or he is positive. And if it's like he is, let me use that word, or she's like multiple, please alert everybody. I tested Hep C positive. Get yourself tested and get treated, so that everybody can get treated. Then another way is, during this treatment, the doctor will tell you, make sure you hydrate. Drinking your water is very, very important, because this medication you are taking, there is possibility of drying up your skin. There is possibility of, making your mouth dry. So all these things, keep hydrating. Drink your water. Thank you, doctor. Drink your water. That will help you to prevent, side effects from this antiviral medication. Then, from all these things we spoke about, can somebody tell me ways? Thank you, Francisca, for the stars. Can somebody tell me ways we can prevent this hepatitis C? We've already mentioned it. I just want to, cap it all. Can somebody tell me ways we can prevent getting this hepatitis C? Somebody that was listening to me, what are the ways we can prevent getting this hepatitis C? What are the preventive measures for this hepatitis C. What are the preventive measures? Being hydrated, Chineke Rosemary, is when you are taking the medication and you have the disease process. But what are the preventive measures? The preventive measures, water cannot prevent it. Blessing water cannot prevent it. What are the preventive measures? I know protecting ourselves, but through how? How can we protect ourselves? Nafi said, water does not prevent Hep C, but how can we prevent getting this Hep C? Avoid sharing personal items. Thank you, Chineke Rosemary. Avoid sharing personal items. Chinonye, water does not stop Hep C. Even if you drink gallons of water, you can still get it. Avoid blood contact. Thank you, Anastasia. Use condoms. That's okay. Thank you so much, Chikaima. We should be careful in sharing needles. Thank you so much. Use protection. Absolutely. Avoid using sharp objects. Thank you for saying that. There are different ways, we can avoid, contacting this, hepatitis C, which we mentioned when we were discussing how it affects, the liver and the symptoms being presented and mode of, port of entry. So what are the preventive measures? Avoid sharing needles or other drug, equipment. Practice safe sex. Use condom during sexual activity with someone who may have this hepatitis C virus. Please protect yourself and protect others. Get vaccinated against hepatitis B. Both of them, they work like husband and wife. So you don't want to get yourself, because if you have Hep B, there is possibility of contacting Hep C along the way if care is not taken. It makes you more predisposed. Avoid unregulated tattoo and body piercing. Some people overdo. They overdo everything. Unregulated. You want a tattoo everywhere. Yes, I don't know the reason behind it. Maybe it's your fetish, or it's something you love, or something you admire, and you are tattooing everything. Make sure they are using new equipment, or they are using sterile equipment. How are they sterilizing the equipment? Are you sure it is going through the normal temperature of it to get it, killed? So make sure all those things are being sterilized or avoided. Use sterile medical equipment. Just like we said, screen blood for hepatitis C before you donate that blood. I know it may be somebody's child, not your child, but somebody's child. It may be anybody close to you, and you want to donate blood. It may be your husband. You want to donate blood. Make sure, please make sure, if you are a healthcare provider listening to me, or if you know somebody that is a healthcare provider, don't be in a quick to give that blood without screening it, because you want to make sure you screen out all those, infections that can be transmitted through bloodborne. Sorry about that. Then make sure you wash your hands frequently. As a healthcare provider, always make sure you have the habit of washing your hands. If you are working in a hospital, believe me, I'm telling you the truth. By the time from home to work, by the time I get home, my hands are like very, very dry from constant washing. That's how important it is. Once there is, water, keep washing your hand. If you are in a healthcare environment, thank you, Maurice, for the star. Keep washing your hand. It is very, very important. Hand washing is the standard precaution, universal precaution for every kind of infection. You don't want to go home with something you don't know. Some people, they come back from work, they jump to the baby. Oh, my baby, they are hugging you. Did you wash your hand? Did you at least even sanitize? Thank you, Maurice, for the start. Did you sanitize your hand and clean your hand from all those things you touched before getting home? You jump into keke. You don't know if that keke, somebody was bleeding in there, that the surface was contaminated, and you come home, you are touching the whole thing jacking you, and you come back home, you put everything in your mouth, you are eating your sandwich, you are eating your bread, you are jumping from one thing to the other without washing those hands. Have habit of washing your hands constantly, whether as a healthcare worker, whether as a regular person. Once you leave wherever you are coming back from, go and wash your hand before doing anything. Hand washing is very, very important. Clean up spills that may have been contaminated. Yes, somebody may be having nose bleeding and they drop in your house. Did you clean up the spills? It's not just wiping the blood. Did you clean it very well with disinfectant to make sure that whatever that is left there is no more there? Because we may have little kids and they will crawl and be touching everything. There is possibility of infecting them. So these are the things, the proper hygiene you can maintain when you are home, because it's very, very important. You know, these babies, they are too much. They touch surfaces and it's their oral phase. They always put their hand in their mouth. How clean is the place? Even yourself, you take your food, you drop it. You know, that person might have been bleeding there and you just wipe it with the tissue without sanitizing. The virus remain and there is possibility of ingesting whatever particles that are there. Then make sure you use harm reduction services, just like we are talking about. Anything you can do not to predispose yourself to blood, contact. These are ways you can prevent spreading this disease. Then what are other considerations? If you get yourself tested and you test positive, like I said, inform all your partners. Please don't shy away. You know how many people you slept with without using protection. Please inform them. I tested positive to Hep C. Please get yourself tested. Fortunate Child said it can be cured with the right antiviral medication. So get yourself tested and get treatment. That will help to save a lot of people. It's not something you have to shy away. I know some people, they hide their health information. They don't want their partner to know. You don't know if the circle, revolves around. She may be sleeping with your friend. You may not even know. And the woman you are sleeping with, the boyfriend may be sleeping with your wife. You may not even know. So the circle goes round and round. So if you notice you tested positive, tell your partner, your partners, if there are partners, tell them, I tested positive, get yourself tested, because you don't want the whole thing to go around and come back to you, because there is possibility of reinfecting you. Because you may think, oh, let me hide it, I don't want her to know. And unfortunately, that her you are hiding has a boyfriend, and that boyfriend may have been sleeping with your own partner, and you may not even know, and the whole thing comes back to circle. So if you have positive, Hep C, make sure you seek immediate attention from the doctor, get your proper treatment. Then if you have history of drug use, if you are a drug user, you know what I mean, please get yourself screened. Go now, get to the doctor. Doc, please, I heard about hepatitis C and what it can do to the liver, damaging the liver, causing liver failure. A lot of people are going from liver issues. You don't even know where the cause is coming from. Please get me screened for Hep C. Get me screened for Hep B. Get me screened for this or that, so that I will make sure I am free. So please get yourself screened. This is not time to caution blame. Why are you using drugs? Go now, go tell the doctor, please screen. Let me make sure I don't have hepatitis C, because you don't want to die young. Once it is in your system, in your bloodstream, it does not go anywhere until there is no miracle, there is no prayer point that will clear it from your bloodstream until you get treated. So please, if you know you are indulging in all those activities that we mentioned, get yourself screened. If you are positive, get yourself treated. There is no alarm. It's just to give you the treatment. You take the course of treatment and you get well. But if you leave it untreated, you are damaging your liver. Then educate yourself and educate others. This is what I am doing. Myself, I educated myself. I am educating you. Now you will be a disciple. Go and educate others about this hepatitis C. It is coming back. It is rampant. Unfortunately, it is rampant. Even wherever we work, sometimes people that tested positive, when you log into their system, they will tell you this person, to show you that this person has it, for you to be precautious. Although you have to use precaution for everybody because you don't know who has it. So please educate yourself, educate others, create awareness. All those things we do, even when we do empowerment in the other page, is a way of making us get used to that disease condition, that when we see the symptoms, I have heard about it, I have studied it, I presented it. Now you get yourself accustomed to that disease condition. This is why we are here. There is no other reason we are doing this. This is why when you see all these pages that are giving you the exact thing, the things that will benefit you. I know sometimes we want to laugh. We want to see that woman shake her behind. We want to see that woman roll her front. I have the front. If I roll my front, I will see 1 million views. But this is not why I am here. I am here to educate us. I am here to make sure that we get the awareness that we are supposed to get. So those pages that that will teach you what is proper. You see, my sister is not just to promote. She is a relationship expert. You see, my sister Paula, I follow her a lot because she talks about your emotions. She talks about those mental health. You see, Dr. Chiamaka that joined us, she is good in what she does. She is, good in her own field, educating you about your body. So you see, Fortunate Child, I am a nurse. I create awareness. I make sure I tell you what this disease condition is all about. I tell you ways you can prevent, ways you can manage yourself. There are other places that teach you the right thing. Please make sure when you see all those things, you listen to them. It's not here to waste, your data or whatever. Listen to things that will benefit you. It's not all about getting data in return. It's not all about getting empowerment in return. This is empowerment. There is no empowerment bigger than creating awareness. Health awareness is very, very important. You save life. I save my life. You save your life. We save other people's life. So please, if you find yourself being exposed to this disease condition, don't take it as a joke. Don't take it as a play. Please go and see the doctor. It may be early stage of it and you catch it on time and you get the antiviral medication. You are clear. And now you have to be precautious. What you do. You have to be precautious. How I behave. You have to be precautious with those things that, that you practice that may, expose you, making you to be at high risk for this disease condition. So let others know about it. Continue to create awareness and take care of yourself. I appreciate you all. So thank you all so much for being here. I see you, Therese. Thank you for that urology or whatever they call it. Thank you. I appreciate you. Ariguzo, thank you for being here. Testimony. You were from beginning to end. Thank you. Chimalume, I appreciate you. Chineke Rosemary. Oyebusi Sandra. Uchechukwu Joseph. Sammy Sam. Thank you all so much. Vivian Wenzi. I see you all. Sandra, you know the people I mentioned their names. Elizabeth Chidima, you are still here. Stella Dapper, you are still here. Chukwu Nonye, thank you for subscribing. Smiley Oge Love, you are, appreciated. Thank you, all my star senders. Thank you, everybody. Thank you all so much. Anastasia, thank you so much for being here. I appreciate you all. Elizabeth Chidima, I appreciate you all. Take care of yourself. I will take care of myself. Love you all. Bye.